It's my first day at work. I don't know what to do. I'm so scared. I'm panicking. Remember, you must be inducted. Someone will be there to show you around. But just in case you happen to, maybe you told them you had an experience, maybe back in Nigeria. I know some of you have experience back in Nigeria, and the experience in Nigeria, the settings is different, I understand. So if you want to give personal care, this is how we do it. This is how we dress before going into a resident room to offer personal care. Okay, what is personal care? It can be giving them shower, wash, bed bath, dressing them up, assisting them to toilet. Yeah, so this is how we dress. We put on our apron. So this will help to protect you and also protect the residents, just in case there is water splash. Your clothes, your uniform will not be wet. This will protect you. Yeah. And after this, I'm gonna go in with my mask. Remember, you cannot be carrying everything in your pocket. They've got stand where you have all your PPE. They call it PPE stand. On that stand, you have your apron, you have your mask, you have your gloves, everything there. So you stand on the PPE designated area and dress yourself up. Now, I have to go in with my mask, but I'd like you to know that not all care homes use masks at the moment. It was mostly used during COVID time. So not all care homes provide this for their staff. But if there is need, please put it on. Yeah? So I'm going to put mine on because I've got catarrh, cough and catarrh, hay fever. I wouldn't like if I sneeze, the resident will contact it. Or if a resident have got hay fever, if they sneeze, I wouldn't like to contact it. Now I'm going in with my gloves. Like I said, you don't have to put everything in your pocket, okay? But you can take more, just in case. Are you seeing what I mean? I'm trying to put this on, and you see, most of these gloves are not very strong anymore. So you can have some in your pocket just in case on the process of giving personal care and this happens. And also, I like to have two. To be honest, I like to have two because these gloves are not very, very strong anymore. I don't like to have one because I might be doing something and it will tear, and my hand, my finger will get infected. So I used to have extra in my bag, in my pocket, just in case I need it. Or just in case I will be needing it in the room, in the resident room. I don't have to run outside to the PPE stand. Yeah, so this is it. We are good to go. Now, I'm gonna go get the pad. Some of the residents have got this in their rooms. Some don't have it in their rooms. Some have kind of storage where all the incontinence pad or incontinence support. Some people still call it pad. You are still right, but it has been updated. Some of them have it in their drawers in the room. Some of them have got it in the storage. So you go there, pick one, and move to the resident room. All right. So this is it. Now that I finish giving personal care to the resident, I need to undress myself. What do I do? So the first thing I have to take off here is the gloves. And after the gloves, I will take off the apron. And after the apron, I will take off the mask. How do I take off the gloves? Now, I'm gonna, first of all, either of the hand, anyone, I pinch it forward, just to release it a bit. Bring it out a little bit, then hold it at the center, and that's it. You see, I fold, Now I have to use my 2 finger and put inside here. I don't need to do this one, no, because it's possible this has been contaminated. You just finish giving personal care. It might be that you just finish giving personal care. It might be that this has been, something is on it, so you don't have to put your hand. And I'm gonna put my 2 fingers here and this way. You see? So once you take it out, you put it in the bin where it should be. Maybe the yellow bin or the white bin in the resident room. It depends on what the care home is using. All right. Now I have to take this one off. This one, I have to take it off. Okay. Then I roll it away from my body. I don't want to do the other side because it's possible something has splashed on it. So backward, I'm gonna roll it away from my body, and I put it in the bin where it should be. And this one, then put it also where it should be. And after that, I'll have to head to the washing basin straight ahead. Come with me, let me show you how you also have to wash your hands. I have to first of all wet my hand. This is okay. Too much. This one. Pause.